walk-in basis, 9 a.m. to 5 p.m. weekdays, all the services that domestic violence and elder abuse survivors may need to get to safety and to get back their autonomy and the control of their lives. And as all of my other speakers have already so eloquently and passionately said, you know, domestic violence is still a terrible problem in our community. Those of us who've been doing this work for a long time know that there have been so many changes and advances, you know, everything from increase in numbers of shelter beds since the beginning of the 2000s to, you know, now the police department has the DV command, you know, school programs, but the numbers are still staggering. You know, last year there were 250,000 domestic incident reports filed with the New York Police Department throughout New York City. The Bronx had about, I don't need to bore you with statistics, but close to 20% of those. The second highest percentage among the boroughs, and we're the second smallest borough. And the homicide statistics, without hitting you with the actual numbers, it's similar. Second highest number of homicides, second smallest borough. So it's really an honor for me to be able to be part of opening this center that is now available to survivors in the Bronx.
Do you have one in Manhattan, or sorry, do you have one just in the Bronx?
Hopefully in Manhattan, we don't know.
So
sorry, there's Brooklyn already, that's been open for 5 years, and there's one in Queens that's been open for 2 years, and the Bronx is the most recent one that just opened.
So you don't have anything from Manhattan, so in other words, in this situation in Manhattan.
Right,
living
so
in the
our
Bronx.
clients, the people who are eligible for our services are residents of the Bronx or people who were hurt in the Bronx. Without regard, everybody's already said, without regard to gender, sexual orientation, immigration status is huge. We see anyone regardless of their immigration status. We have a lot of staff who are bilinguals, a couple of whom are in the audience, with Spanish, and then we also have staff who speak French, which is another big language in the Bronx, as well as it turns out that Albanian and Italian are the next most prevalent languages, and we have a couple of people who speak those languages. And just to give you a sense of how things work at the center, we have co-located all the different providers who you probably are already used to working with, established organizations that already have been working in the Bronx for years and years, who now have staff, mostly full-time but some part-time, who deliver their services, like I said, on a walk-in basis to people who just present themselves because they're finally ready to take that step to get some information. We have, just for starters, we actually have the Domestic Violence Bureau of the District Attorney's Office share space with us. So we have the criminal justice side of things. We also have 2 police officers who are on site full time who can take reports. A probation officer who can help folks who have whose abuser may be on probation to report a violation, that kind of thing. And then on what we call the civil side of the Family Justice Center, we have all the wonderful organizations doing case management, advocacy, counseling, legal services. So here we have folks from Jewish Court, Sanctuary for Families. Today, Steve Horizon obviously is a big presence in our center. VIP, Relative Prevention Program, Staff to Get to, African women. And then on the legal, those are counseling and case management services. On the legal side, the Motion is now full-time at the center. Sanctuary for Families, lawyers are there, legal aid, Disney, domestic violence programs, and Urban Justice Center. And the kinds of legal services that we provide on the civil side are family law, matrimonial, and immigration services. So it was great to learn about the housing resources that are available just up the block, and we obviously want to link closely with the folks in the community. You know, you guys, mental health providers, are on the front lines of identifying these problems. You know, I just went to a talk where something so obvious became obvious to me, that oftentimes you'll be working with somebody who is presenting with the problems that we know are the results of domestic violence, depression, PTSD, to get somebody to talk about what's going on in their life. And so you should really know that once, you shouldn't, you're probably not, but you shouldn't be afraid to unearth that, because now there are so many services that are available in one place, and you should really feel free to send them. Feel free, I urge you, you must send your clients who present with domestic violence in their life to the center. And the address is 198 East 161st Street. We have lots of brochures outside on the table. We have more in a bag somewhere. And I have cards, and you should call, stop by for visits, whatever will help you feel more comfortable referring people and knowing what we offer at the center. We also actually, I always leave this to the end, I don't know why, we have a children's room, which is wonderful, where clients can meet their kids while they're getting services.
Thank you so much. Quick question. If someone is from abroad that you don't serve, like Manhattan, let's say, and can they call the number you gave and they will refer them to an organization similar to yours and they can get help in Manhattan?
We sure try to provide references of referrals of people call. There's also 311 that knows all about, they have a whole category of assistance under domestic violence. A lot of our clients get to us through 311, so they know the numbers of the big providers and the smaller providers in Manhattan. But absolutely, if somebody calls, even if somebody comes, if somebody comes because they've heard of it, if they're walking by for some reason, we do not turn people away empty-handed. We really try to help people.
There's also a hotline, a state hotline?
There's also the New York City hotline is 1-800-621-HOPE. That hopefully most of you are aware of. That we just call it the DV hotline. We've done a big public outreach campaign as well. You hopefully have seen posters kind of this size. There's some very big ones that are about helping people identify what's a healthy relationship. And in the Bronx, our address and 311 and the 800 number are noted on the posters. We have some.
Yeah, in addition, I'm Officer Campbell from the Mayor's Office to Combat Domestic Violence. We also have resource guides or resource directories. I brought some with me today. So feel free to actually, one of two things, you can actually go on our website, which is nyc.gov/domestic violence. And if you go to the right side of that, you'll see where it says publications, educational material. And then you'll click on that, and at the bottom of that, it'll actually disclose what is our material order form. And then when you press on that, the order forms actually come back to me. Well, I'll actually send out to you resource directories, posters, DV brochures in various languages as well. But feel free, we brought a lot of material with us today, and that's on the table out front.
And our social workers have direct links and memorandum of understanding with all, whether Sanctuary for Families, Safe Horizons. There are many large organizations that have offices in every borough.
Thank you.
So within our own staff, we have it.
Thank you so much. Okay, I'm going to introduce you.
Everybody understand, right? Todo el mundo entendió, no necesitan traducir español, ¿verdad?